Our Anita Brickman is live at the National Rehabilitation Hospital in Northwest D.C. with more on that part of the story. Hi, Anita.
Hey, how you doing, Leslie? I'm joined by Dr. Carter Mitchell, an orthopedic surgeon from MedStar Georgetown, who practices with this hospital as well. And Doctor, you trained with Dr. Andrews.
I did.
Now, what's going to be ahead for RG3 in the rehab process? I mean, how painful is this to start, and what does he do in the days and weeks ahead?
Well, in the acute rehab process, what we want to do is control the inflammation in the knee as well as the swelling and try to get his range of motion back.
It hurts a lot, doesn't it?
It does. So the nurses will be taking care of his pain control and be very attentive to him.
But how long can this take? I mean, we're talking about an elite athlete here, so some of them have come back pretty fast.
After an ACL and an LCL, we're talking somewhere between 8 and 12 months. However, it really is dependent on the patient.
Now, obviously, most people who have these tears are not elite athletes like RG3. There are a lot of these problems, right?
Approximately 250,000 ACL tears happen each year, and most of them are in recreational athletes. So what we like to do is focus on preventing these injuries mostly.
How can you prevent them?
Well, there are many techniques that we're studying, mostly strengthening the hamstring and getting mostly young women to land properly. So muscle memory and training is very important.
Now let's go back to RG3 briefly here. A lot of people are wondering, can he be at 100%, especially because we're not talking about this being the first ACL procedure, but the second and a revision to that. Can he get back to 100%?
Absolutely. I think there's no reason to believe that he won't get back to his previous level. We've come a long way with how we do these procedures and how we rehab from them.
Dr. Mitchell, thank you for that. And coming up at 5:30, we're actually going to meet a young woman who suffered the same kind of injury, and her physical therapist is going to show us a very cool anti-gravity treadmill that may be in the use for RG3 as well as the rehab progresses. Derek, we're going to send it back to you.
We're going to keep it optimistic, Anita. Thanks for that.
Well, as Bruce just mentioned, right now, Redskins QB RG3 is recovering from successful surgery to repair his injured right knee. Dr. James Andrews released a statement saying Robert Griffin III had a direct repair of his LCL and a redo of his previous ACL reconstruction. We expect a full recovery, and it is everybody's hope and belief that due to Robert's high motivation, he will be ready for the 2013 football season. Now, I am live at MedStar National Rehabilitation Hospital, where we're here to talk about the fact that it's not just football stars who tear their ACLs. Right next to me on this very cool looking treadmill is Miss Dorsey. Hello, how are you, Carly?
Good, how are you?
14 from Olney, Maryland. When did you tear your ACL?
I tore it August 18th playing for Sherwood High School volleyball.
What happened?
I was coming down from a block and I landed on the other player's foot and my knee just came in.